Hey guys, Dr. Jackson here, and I'm going to respond to a DM message I got from a subscriber on TikTok. And the gist of the question is that this patient has had a history of allergies. The owners have tried a bunch of different medications to treat for allergies, but none of them are working. The owner noticed that the pet had fleas, has since treated the fleas, but the pet is still experiencing itching, licking of the paw, scratching, etc. So this pet sounds like he may have had a flea allergy. What that means is that if one flea bites the pet, it can set off a complete allergic reaction, which involves itching, scratching. Sometimes the pets will itch and scratch to the point where they're causing their skin to bleed. And it just causes us an array of clinical signs. Keep in mind that this is not like an environmental allergy or a food allergy, because it's an actual parasite that's crawling on the skin. So irrespective of what medication is used, if you don't get rid of the flea, a lot of times the pet's still going to be clinical. Also, because the fleas cause an allergic reaction, a lot of times you also need to treat for the allergic reaction as well, just to get the pet's skin back under control and to get the itching to stop. So I would personally recommend making sure the pet stays on a flea prevention, parasite control, just to make sure that we don't have issues with the flea allergy, especially if we also have underlying environmental allergies and food allergies as well. So this is a pet that sounds like he may have a flea allergy, so just make sure if the pet's going outside, even in the winter time, flea medications is recommended. I've seen at least 2 or 3 cases within the last 2 weeks of pets that have had fleas, and we have been in 17 to 20 degree weather. So it's been quite cold, but fleas are still out there. So make sure you do not skip a month of your flea control, because it can cause your pet to have an allergic reaction. Keep in mind that this is just me responding to a question. It's not any medical advice or anything like that, but this one kind of seems straightforward to me, but who knows? That's my take on it. And if you all have any more questions, make sure you send them to us in our DM.